Alzheimer's disease is the most common form of dementia, which is the general term for the impaired ability to remember, think, or make decisions. Alzheimer's is the seventh leading cause of death in the United States. It is characterized by memory loss and other declines in mental function. While there isn't a way to prevent Alzheimer's, research has found some things you can do to reduce your risk of developing the disease. It's not a bad idea to establish these habits anyway, because they offer many other health benefits as well. Here's what to know about the risk of developing Alzheimer's and what you can do to lower your chances. Who is most at risk? Alzheimer's disease affects more than 5 million people in the United States. Your risk of developing it goes up with age. Most people who develop this disease don't start seeing symptoms until about age 65 years. Known as late-onset Alzheimer's, this type is the most common form. The other type, early-onset Alzheimer's, is less common. It affects only about 10% of people with Alzheimer's. As you may have guessed from its name, early-onset Alzheimer's occurs earlier in life than age 65. Symptoms can show up anytime between a person's 30s and mid-60s. Lifestyle habits. Leading a healthy lifestyle has many health perks, including the possibility of keeping your brain sharp as you age. Specifically, here are the things you can do, or may already be doing, to lead a healthy lifestyle and potentially reduce your risk of Alzheimer's. Keep high blood pressure under control. High blood pressure has harmful effects on many parts of your body, including your brain. Your blood vessels and heart will also benefit from monitoring and managing your blood pressure. Manage blood sugar, glucose. Consistently having high blood sugar levels can increase your risk of various diseases and conditions, including problems with memory, learning, and concentration. Maintain a healthy weight. It's clear that obesity is linked to cardiovascular disease, diabetes, and other conditions. What's not so clear is how best to measure obesity. Several studies have shown that the ratio of your waist to your height may be one of the most accurate predictors we have of obesity-related diseases. Follow a healthy diet. Get a variety of fruits and vegetables, whole grains, lean meats and seafood, unsaturated fats like olive oil, and low-fat or non-fat dairy products. Cut back on foods that contain other fats and sugars, including ultra-processed foods. Be physically active. Exercise has many health benefits beyond possible Alzheimer's prevention. It is recommended to get 150 minutes of moderate intensity physical activity a week. That could be walking and or cycling for 30 minutes 5 days a week. Keep your mind active. You can do this by playing games such as board games or word, logic, or number puzzles. Get creative by painting, writing, sculpting, or crafting. Stimulate your mind by reading a book, learning a new skill, working or volunteering, and socializing. Stay connected. Isolation and loneliness can increase your risk of Alzheimer's. Getting in touch with loved ones or joining a club or another social activity can help you maintain social connectedness. Get treatment for hearing problems. Not being able to hear properly may make communicating with others more difficult. You can also protect your ears from loud noises to help prevent hearing loss. Sleep is super important for our bodies and our minds. Aim for 7 to 8 hours a night and see a healthcare provider if you are having any problems sleeping. Prevent falls and head injury. Head injuries are associated with a higher chance of developing Alzheimer's. 8. A common cause of head injuries to older adults are falls. To reduce falls, you can fall-proof your home, wear supportive shoes with non-skid soles, and participate in fall prevention programs. Limit alcohol consumption. Drinking too much alcohol can lead to falls and make other health conditions worse, including memory loss. Reducing consumption to 1 or 2 drinks a day, at most, can help. Don't smoke. By not smoking, you'll improve your health by reducing your risk for serious conditions, including cardiovascular disease, stroke, and some cancers. You may be less likely to get Alzheimer's as well. Again, there are no promises that doing any of these things will prevent you from getting Alzheimer's. If you follow these recommendations, however, you will be helping yourself out in more ways than one. That's because you'll be reducing your chances of developing many other health problems at the same time. There is no harm done by checking off as many of these boxes as you can.